Hi everyone, this is Dr. Robin Lewis. I'm a naturopathic physician practicing here in Vancouver, British Columbia, Canada. And today we have a really juicy episode. So the conversation on testosterone has been growing and growing over recent years. It's moving well past just the discussion around muscle growth and endurance, and now we're talking about testosterone in a broader context when it comes to fertility, cardiovascular health, mental health, and more. Today I'm going to focus on just one aspect of your cardiovascular health because there is a lot of literature on this, and this is cholesterol in relation to testosterone levels and testosterone replacement therapy. I'm going to start by talking about what is low testosterone, what does that look like, what is suboptimal testosterone, and then we're going to finish by talking about testosterone replacement therapy. Not that this is the only solution for optimizing testosterone, but I want to keep today's episode short and sweet, or at least I'm going to try to. So we're going to focus on those two main conversations. What is low testosterone? Is it affecting your cholesterol levels? And is testosterone replacement therapy the solution? Low testosterone is related to a wide variety of different conditions in the body. Yes, it's related to poor muscle growth, poor endurance, increased fat relative to muscle, but it's also related to things like low mood or depression, poor focus, low libido, low motivation. And from a cardiovascular perspective, it's related to an increased formation of lipids like cholesterol. It is related to blood vessel wall dysfunction and overall just an increase in plaque formation inside of our arteries and our veins. So if that's all you came for, there you go. Low testosterone puts you at a higher risk of elevated cholesterol and elevated cardiovascular disease. But I do encourage you to stay because there are some nuances that are very important to understand when it comes to what is low testosterone, how do we test for it, and is testosterone replacement therapy the solution for your cholesterol? Because unfortunately in medicine, it's not always that straightforward. Just because low levels of something puts you at a higher risk of developing a condition like high cholesterol, it doesn't mean that simply replacing that hormone will necessarily benefit your cholesterol. So that's what we're really diving into today. The reason I start with low testosterone as opposed to high testosterone is because naturally, assuming you're not already taking that hormone, men especially will either have normal or low testosterone. And that is because there are so many things in our modern day life that dampen our testosterone or our testosterone response. So these things include chronically elevated stress, xenoestrogens, which are essentially chemical compounds that look kind of like estrogen that come from plastics and other environmental toxins, testicular injury, although that's usually a pretty severe form of low testosterone, insulin resistance or diabetes, which is incredibly common, obesity, poor diets like a high inflammatory, high refined sugars, high in non-organic dairy kind of diet, head injuries like concussions, medications, and so on. So as you can see, there are a lot of different things that can cause low testosterone, and I will elaborate on that in a different video. But for now, I just wanted to point out how many different things could be contributing, and figuring out which of those things is leading to your low testosterone is incredibly important because that's really where we get into root cause medicine. We want to remove the triggers so that your testosterone can start to optimize itself. By understanding what's causing your low testosterone, you can better avoid having to go on things like testosterone replacement therapy because like any medication, it comes with its own list of cautions, and for some people, it's just not the right fit. But before we go into any of that, we really want to talk about how do people actually test for testosterone, because this is a big issue in our current medical system. So I want to make sure that you really understand this well. From a testing standpoint, it's not always clear what suboptimal testosterone looks like. We certainly know what low testosterone looks like, the extreme lows of testosterone, But when it comes to optimized testosterone, there's not actually a clear consensus in the literature. I am, however, going to tell you what my understanding of this is and how you can better evaluate testosterone, so a less simplified approach, but do know that it's not really a consensus. First off, total testosterone as an isolated marker is not that helpful because it really doesn't tell you how much free testosterone is available for the body. So what I mean by this is in optimal situations, only 2% of your total testosterone is actually free. So what that means is it's not bound up by these compounds that make it inaccessible to go into tissues and things like that. So it creates an actual testosterone response in the body. So the two main things that testosterone gets bound to is something called sex hormone binding globulin and albumin. So there's another marker that is called bioavailable testosterone that is referring to completely free testosterone, which means it's not bound to anything, or testosterone that's bound to something called albumin, which is a loose bound testosterone. So it is more available to create a response inside of the body. So you want to look at total testosterone, sure, free testosterone, and bioavailable testosterone. So really the free and the bioavailable are the testosterone levels that are available to your tissues, so it can have an effect on your brain, your muscles, your adipose tissue, and so on. And even if you do get your free testosterone measured, the ranges in which are given are very big. So for example, free testosterone in adult men should be between 44 to 244 picograms per milliliter. That is a huge range. And what we find a lot of the times is, even if you're inside of that range, so you're not below 44, you can still feel all of the effects of low testosterone. So this is where conventional medicine doesn't really lend itself that well to looking at optimizing testosterone, because you can't really discuss that with someone in a 5 to 15 minute appointment. You can't take the time to look at all of the symptoms that could be testosterone related, take into context the reference range and maybe suboptimal levels within that reference range. And so a lot of people will be told that your testosterone is totally fine, even though they have tons of low testosterone symptoms, and maybe they're near the bottom end of that range. The other thing to note is that they don't usually account for the different age brackets. So someone who is 20 should certainly have a higher testosterone level than someone who is 50. So they often don't give nuanced differences between like the different decades, for example. So this brings me to my second point, which is that they don't often break it down by different age brackets. So your testosterone really shouldn't start revving up until you hit puberty. And then it really shouldn't start declining until about 40. But even then, it should be a very slow decline, not a rapid decline like we often see more commonly in the general population. So this is really why I encourage people to work with either a naturopathic doctor or a functional medicine doctor or some other very educated practitioner who can spend the time with you to figure out the nuances here and really look at your age, the different markers, so you have a more comprehensive view of things, and the symptoms to really make a decision based on all of the factors. The third thing I want to make sure that you're aware of is there's also something called androgen receptor sensitivity. So how well do the receptors that receive testosterone respond to that testosterone? In other words, how much testosterone does it take to actually see an effect? So you can have enough testosterone, but if your tissues aren't very sensitive to the testosterone, then you won't have as much of a testosterone-like effect inside of your body. So this is, again, another way of looking at this picture. So the amount of patients that I've seen that have come to me telling me that their testosterone is totally fine, but they've only had one marker looked at and a 2-minute conversation with their doctor is staggering. So I really do encourage you guys to be your own health advocate and really look a little deeper into this topic, especially if you feel like you're exhibiting the symptoms of low testosterone. This topic is super relevant and important to understand because low testosterone levels, even in a strict definition sense, meaning they're below the reference range, I'm not just talking about suboptimal, the low levels, once you hit 40, are approximately 10%. But then as you get towards 70, approximately 70% of your bioavailable testosterone is below that reference range. So this is incredibly relevant, certainly as we age, but we're also seeing a lot more of this in younger populations, and that doesn't even take into context suboptimal testosterone, where maybe the levels are on the low end, your tissues aren't responding well to it, you're not taking into an account that this 20-year-old has the same levels as this 50-year-old, things like that. All right, so enough about that. Let's talk about testosterone replacement therapy. Is it the solution for your cholesterol? First thing is, if you do it under medical supervision, it is generally a safe therapy. And if it is going to create a negative side effect like high cholesterol, you're going to at least catch it fairly early on because you'll be doing regular screening. The issue with testosterone replacement therapy, or TRT for short, is that it's often not being done medically supervised. There's a huge black market for TRT, and that's part of the issue. If you're getting it in a non-medical setting, you're likely not getting the regular screening to monitor whether or not it is optimizing your levels or sending your testosterone levels too high. Because in addition to some of these more well-known side effects like shrinking testicles, too much testosterone can actually elevate your cholesterol as well. So it's really not one of those things where if you just take testosterone, you're going to see an infinite lowering of cholesterol. There is, of course, too much testosterone, and once you reach that too much testosterone level, it actually seems to, again, negatively affect your cholesterol levels. So this is an important thing that not a lot of people understand, is that too much testosterone can also affect your cardiovascular health in addition to some of these more obvious symptoms. But let's say you do testosterone responsibly, you do it under medical supervision. Is it helpful then? Well, they've studied this in hypogonadal men, which essentially means men with low testosterone. And under medical supervision, they were given testosterone replacement therapy to bring those testosterone levels back up to normal and optimal. And in those cases, they often will find an improvement to your bad cholesterol, like LDL cholesterol or total cholesterol as a whole. So the good news is, if you do use it responsibly, it can be helpful. They believe part of this might be due to the beneficial effects that optimal testosterone can have on our adipose or our fat tissue. So because low testosterone is also linked to increased fat tissue, especially relative to your muscle mass, they believe that might be part of why your cholesterol levels can balance out as well. This also might be why testosterone optimization can also be helpful for things like hypertension, because all of these things have a very clear risk factor when it comes to things like obesity. So testosterone can help balance out the weight, increase the amount of muscle mass, and that is tissue that is really healthy for things like hypertension and cholesterol. So that's just one of the reasons they think that testosterone might be helpful for these type of cardiovascular conditions. When it comes to whether or not TRT is helpful for people with suboptimal levels of testosterone, now that's quite debatable. They're not really studying that in the literature, so it's hard to give a firm answer. And that's why I tend towards some other therapies like optimizing sleep, lifestyle, exercise, stress, supplements, herbal medicine, some of these other supportive testosterone therapies rather than TRT. And it's also important to know that there are other options available to people because some people don't want to go on hormone replacement therapy or they're not good candidates, like men who are trying to conceive. All right, in the honor of keeping things short, we're going to stop there. But to summarize, low testosterone or suboptimal testosterone is very common. It does put you at a higher risk of developing things like elevated bad cholesterol. Testosterone replacement therapy can be helpful, but it is to be used with caution because it can actually worsen it if used inappropriately. And do know that there are other options available. I hope to go into those other options in a different episode with you soon, so stay tuned. Thank you so much for listening. I appreciate you all, and have a great day.